Okay, today the Houston Health Department is reporting 1,137 new cases of COVID-19. That's 1,137 new cases, bringing the total case count for the city of Houston to 99,396. The total number of deaths is increasing by 3, and that brings our total death count to 1,140. My number is 1,444. So I don't know which one is right. Yeah, but okay, well, I think it's 1,444. Okay, so I think that number may be off. But anyway, increasing the number of people that have died in the last 24 hours as a result of COVID-19 is that number is by 3. So yesterday, the U.S. reported, I think, well over 3,000 deaths in a 24-hour period, which is a reflection of the impact that this virus is having on people throughout the United States. And so we are paying very, very close attention to what is occurring right here in Houston. The virus has taken a heavy toll across the country, and so we are continuing to encourage people to put on their masks, to engage in their social distancing, and to wash your hands. Earlier today, I joined family and friends and Chief Osaveda and others to say goodbye to Senior Police Officer Ernest Leal, Jr., who died of COVID. He dedicated almost 36 years of his life to our city, and we can honor his memory by just wearing a mask, practicing social distancing, washing our hands frequently, and getting tested to slow the spread of the virus. And certainly I don't think that is too much. That is too much to ask. Let me remind people that we have yet to experience the potential surge from the Thanksgiving holiday weekend. And so, again, if you travel or if people travel to your home, or if you were in the midst of large gatherings over the Thanksgiving weekend, from that Thursday through, let's say, Monday morning, I'm encouraging you to get tested if you have not already gotten tested. Please get tested. And if you were a part of these large gatherings, please keep your mask on and to try to quarantine yourself, isolate yourself from others until you have gotten tested and received your results. So please take it seriously. I'm also, again, reminding these bars that are now serving as restaurants, people that are holding events, for example, in these clubs, to please operate within, to reduce the number of people that you are having at your establishments in order to maintain some degree of social distancing, or at the very minimum, make sure that everyone in your establishments are wearing masks. I'm also indicating to people, if you walk into an establishment and it is already crowded, I would strongly advise you to turn around and go someplace else, preferably home. And so I'm asking you to do that. I'm asking these owners of these businesses to bring down your crowd size. And I'm making this plea again to you. I don't want anybody to say that to the extent, for example, I elect to put in a curfew in the evening, that I didn't ask people over and over and over again to be mindful of the ramifications of the community spread of this virus. And as you can see today, I'm reporting 1,137 cases in the city of Houston. So again, I'm asking those who are business owners, those patrons, people who are attending these gatherings, to be mindful of the health risks that exist, and that you need to modify your behavior, and you need to self-control yourselves, as all of that will be helpful. So again, I just want to make sure I'm saying it over and over and over again, so people will know. We are looking at the hospital numbers continue to tick up. Not as fast as was taking place in June, July, and August, but they're ticking up nonetheless. What we do know from this virus, or the effects of this virus, it can literally go from 0 to 60 very, very, very quickly. So again, we are not going to be seeing the impacts of the Thanksgiving weekend until possibly as soon as this weekend or the following weekend. Dr. Peirce can speak more specifically to that. But for the people in the city of Houston, I'm asking you to really check your behavior. No house parties or large gatherings. Okay, none of that. No on the street, parties. We don't need any of that. Avoiding large crowds, keeping your mask on. All of those things will help us to manage this virus while we wait on a vaccine coming into our area. So let me stop here and let me bring on Dr. Peirce.
Thank you, Mayor. As the Mayor pointed out, so today's number, 1,137, is a large number of new cases. And Mayor, you're right, your document is correct. The number of deaths is 1,444, and that is a very large number. If we go to the slide showing the hospitalizations. So this is a graph showing from our partners at SETRAC, and in the top is the ICU beds, and that big spike you see there in July is the number of ICU patients admitted with the diagnosis of COVID disease. And if you look off to the right, you'll see where we are now, and you'll see we've got Thanksgiving marked, and the slope was increasing prior to Thanksgiving. It has continued to increase since Thanksgiving. We hope that will level off at some point, but I want to remind you, when you go back to look at that peak in July, there is a downslope following July. That was not because the weather changed. That was not because the virus changed. That was not because any vaccine was available. That was because people changed their behavior. And that downslope is a clear indication of the impact that we as individuals can have if we wear our masks, remain distant from each other, don't go into large gatherings, all these things you've heard again and again and again. So again, I would point out that the numbers currently are increasing. And remember, as we've talked about, this is the time of year when, while the weather and the temperature doesn't seem to have much of an impact on the virus, it does seem to have an impact on our behavior because we tend to gather indoors more so than outdoors. And being indoors is a greater risk than gatherings that may occur outdoors. So remember, when it comes to gatherings, none is best. Small is better than large. Outdoors is better than indoors. With masks is better than without masks. With hand washing is better than without hand washing. Each one of these things is another layer of protection. The more layers of protection, the more protected you are. No single layer of protection is adequate. So just because you're meeting outdoors does not mean that you can't wash your hands, that you don't need to wear a mask, and so on and so forth. The other thing I want to point out is in terms of masks, it's the mask. I'm seeing a lot of people now that are wearing just a shield, and the purpose of the shield is to protect your eyes from somebody else's droplets hitting your eyes. The shield does nothing to protect anyone around you from the particles that come out of your mouth. The only thing that will protect the particles coming out of your nose and mouth is a mask that's on your face. And I'm also hearing people say, well, I can't wear a mask because it makes me uncomfortable, or I have a history of asthma, or I have sinus problems. No, the only acceptable reason for an adult, actually anyone over the age of 2, to not wear a mask is if they are in such a condition such that in an emergency they would be unable to remove the mask on their own. They would need help removing the mask. So if you're at the grocery store pushing a shopping cart, not wearing a mask, you need to be wearing a mask. Saying that, well, I've got a history of asthma is not an adequate reason to not have a mask. Wearing a shield does not replace the mask. The last thing I want to talk about is earlier this week, the CDC came out with new guidance on quarantine. It's actually not new guidance. It was a scientific brief. It is the CDC's guidance on quarantine has not changed. It is still 14 days. The scientific brief they put out indicated what the risks are if you were to go to 10 days without testing or 7 days with the test. And for example, if someone were to quarantine for 7 days and get tested on the last 48 hours of that 7 days, that person would still have on average that group of people would still have on average a 5% risk and as much as 12.5% risk of being actively spreading virus when they came out of that quarantine. That is a very high percentage. That should not be used for the general public. So I just want to remind folks that as people have been saying the CDC issued new guidance, they did not issue new guidance. The guidance on quarantine has not changed. They issued a scientific brief to educate people who do what I do on the consequences should you recommend such changes. And we currently are not recommending those changes. But we had a long discussion this morning with the local health authorities from the region about this, and we will probably be coming out with a consensus statement sometime soon.
Thank you, Dr. Purse. Chief Acevedo.
Thank you, Mayor. Thank you for being with us today, as you have been with both of our agencies throughout this tragic year with COVID. Before I give my numbers, I just want to say, Ron, thank you for our departing city attorney. Thank you for this one. We're getting used to you. You're leaving us. The truth is, you were a great city attorney for the police department. You were always there for us, and I just want to tell you on behalf of all of us, thanks for all the job that you did to keep us out of trouble and to keep us with the law, and everyone else. And Harry, I'm really going to miss you, my friend. You've been a great friend and a mentor to all of us, and I'm glad the mayor's going to keep you on speed dial because we love you. And Vic, thanks for keeping us going with the very trying situation with our fleet. But congratulations to the interims. And to Arturo, welcome on board, Tocayo. Our numbers, Mayor, as you know, we have had an increase. We've had a spike, and like we were saying last week, we can honor the sacrifice of Officer Leal and all of our first responders by following the guidelines that you speak about almost daily. And as of today, we have 133 members of our department that are absent, away from work, quarantine due to COVID-19. We have, out of the 133, we have 90 that are positive, with 43 pending the results. As so far, since this pandemic started, we've had a total of 681 members of our department that have been tested positive for COVID-19, and I'm happy to report 591 that did come back positive, returned to work. Having said that, we did lose Officer Leal, and we did lose 2 of civilian members, so it's very important for the police department in order for us to stay healthy so we can continue to combat violent crime and property crime and traffic deaths in our community. We need to help keep our workforce safe, so please keep following the guidelines of the public health professionals. Thank you, Mayor. That's my report.
Thank you, Chief. Chief Pena.
Thank you, Mayor. If I may, I would also like to congratulate all the new appointees, Kenneth, Carolyn, my friend Arturo. Good to see you. Thank you, and welcome aboard. And I want to congratulate those that are going on to other endeavors. Ron, thank you for your friendship and your counsel. I'm going to miss our conversations, both of them, all 4.5 minutes of them. But in all seriousness, one of the smartest men that I've met. Vic, thank you for the work that you guys have done for us in our fleet. And certainly I'm going to miss my friend Harry Hayes. That was a surprise today, Mayor, when I heard he was leaving. And so we're going to miss him. But congratulations on your future endeavors, and good luck. The numbers for the Houston Fire Department. Today we are at 137 firefighters in quarantine. We have 36 that are positive for coronavirus, so the numbers really haven't changed. We did see an uptick just following the city's numbers as well in the last month, but we're going to continue with our protocols, our safety protocols. We've secured the stations. They remain secured, so there's very little public interaction with the fire stations, and that's in efforts at force protection for our firefighters. So we're hoping that, again, that as a community, we do what we've done in the past and ensure that we're doing our part to provide a safe environment, and the recommendations remain the same. Wearing your mask, proper hygiene, and the proper distancing. And we're asking the community and the businesses to also help us adhere to those safety precautions. In the last 24 hours, we responded to 70 complaints for occupancies, and those have been resolved on the spot. Again, I want to thank the business community for their efforts, and we ask them to help us maintain a safe environment for your workers and your customers. Thank you.
Thank you, Chief Pena. Look, yesterday, Mayor Pro Tem Martin, Councilmember Gallegos, and the other council members passed 2 important items funded by the CARES Act to help Houstonians who are facing challenges as a direct result of the pandemic. First, we approved $10 million in additional funding for the city's Small Business Economic Relief Program, bringing the total allocation of CARES Act 2020 dollars used to fund the program to $35 million. Since August, the program has provided grant assistance to small businesses and chambers of commerce that have been adversely impacted by the COVID-19 pandemic. A business may use the funds for payroll, accounts payable, rent, mortgage, personal protective equipment for employees, and marketing strategies, including creating an online presence and other sales alternatives to keep the business afloat during an unprecedented time. City Council also unanimously approved an additional $20 million in direct assistance to bring another round of COVID-19 relief funding to City of Houston residents. Eligible City of Houston households can use the direct payment of $1,200 to cover any of their needs, like paying for rent, utilities, food, child care, medicine, and dog food, cat food. There are no restrictions on how they use it. The program will begin by providing assistance to households already identified through other COVID-19 relief programs administered by Baker Ripley and the City of Houston households that applied to the Harris County Direct Financial Assistance Program administered by Catholic Charities and did not receive assistance because of a lack of program funds. More than 100,000 people applied, an indication of the great amount of need in our city during the pandemic. And so while we wait on the federal government to provide additional relief to people, we have taken the step of providing this step. All of these dollars will be provided in this month, the month of December. Baker Ripley will distribute the funds on behalf of the city by the end of the year when the CARES Act funds expire. Let me bring up Claudia Aguirre. Claudia Aguirre, who has just been a tremendous leader at Baker Ripley in tackling this and so many other things. I do want to take the opportunity to thank Baker Ripley for being just an invaluable partner with the City of Houston. Claudia.
Thank you, Mayor. First, let me thank you for your leadership during these continued challenge times and for your trust to Baker Ripley. Baker Ripley, along with so many partners and nonprofits and volunteers, have been helping our vulnerable community since the onset of the pandemic. And today we're proud to continue this partnership with the City of Houston to distribute the $20 million. These funds, as you said, will be utilized by households who have already applied to previously COVID relief programs and were not able to receive any assistance due to the lack of funds. So this will allow thousands and thousands of families who have already applied get some relief to help with rent, medication, food, anything that they need to lift their family during these trying times. So thank you very much.
And in that manner, these dollars will be able to be distributed in the month of December. So that's where we are. I'll take questions. I do want to, before I take questions, one thing I did want to say again by Ron Lewis that I did not say earlier is that when we came in, we were facing a huge, as you know, pension crisis. Ron was the attorney that led us through that. So I do want to acknowledge that because that was monumental, historical, and it was done and brought to a resolution under his guidance and under his leadership. So thank you again. Thank you for that, Ron. Okay, we'll take any questions anyone may have.
Hey, Mayor.
Yes.
When the vaccinations start, will cards be given to those receiving the vaccinations?
Where's Dr. First? There.
That's a good question. So my understanding at this point is certainly after the first vaccination, they will to make sure the person knows which type that they, when they get their second, make sure they get the right one. I don't know yet, but it would not the least bit surprise me if they would get some sort of documentation after the second dose, but I don't know that for a fact yet.
Dr. Peirce, can you speak to the fact that I think there's some people who think like they hear all this good news about the vaccine and they think they're going to get the vaccine tomorrow. But for the vast majority of us, how much longer do we have to wear a mask and be like
Okay.
not crazy?
So that's really two questions. One is, can the average person, when can they expect to have availability of the vaccine? And then when can we start wearing masks? So I see those as two different questions. So the projections that I'm hearing from the federal government, remember, this is basically it's a federally driven program working with the states and the locals. So the states are telling the federal government who the vaccine providers will be and approximately the amount of vaccine they're going to get. And so when we hear from those folks who have the national picture, the answer I keep hearing is for the average person who's not going to be in a priority group, they can look forward to it in about April. That's the time I keep hearing again and again and again. Unfortunately, I don't have insight into the data behind that, but that's what I keep hearing from people like Dr. Fauci, people who I trust. Your other question is, at what point can we stop thinking about having to wear masks? And that would probably, I anticipate the CDC will come out and recommend that when we believe we have reached some level of herd immunity across the United States. Now, that won't happen until we believe that 70+% of the population has immunity. So it's going to be, so right now, the studies are going on to find out how many people today have been, these are the prevalence studies, find out how many people today may have immunity based on prevalence studies. And that's going to be a very small percentage. The CDC, in New York City, they're estimating that would be the highest. In New York City, they're estimating it to be in the neighborhood of 23%. And that's probably the highest of any community in the country. So ours will be much below that. But that means a lot of people are going to have to get vaccinated in order for us to reach 70% before we can stop worrying about wearing masks.
And can you also speak to, I just had another, you guys have been talking a lot about the surge and people going up. I know in Houston and Harris County, there's not a lot of events and things like that, but there's a lot of, in surrounding counties. I mean, I say this just because yesterday there was that gala up in the Woodlands where 400 people went, right, with the governor of North Dakota and things like that. And then, but the people come, they drive down 45. So how worried are you about, you try to do your best in Houston, but people still drive around and could contribute to that?
Yeah, you raise a really great question. So, Mayor Turner can lead this community, and people can listen to Mayor Turner, and if everyone inside city limits of Houston did what they were supposed to do, they would have a hugely positive impact, right? We can't necessarily control what goes on in surrounding counties, but we can minimize the impact on our overall community if we here locally follow the recommendation of the mayor, the judge, myself, Dr. Shaw. If we were to do that, we'd have a huge impact. But folks from outside surrounding communities are going to continue to come and go. And yes, every time they do that, we run the risk of them spreading virus a little bit more. But that's why really, as Texans, we don't need to look at it as Houstonians versus the people in Montgomery County. We need to think about this as Texans. And all of us as Texans need to do our part.
A question for the mayor. I know you spoke about the bars, and in the past you have talked about, maybe some rules or plans of how you guys can kind of control the capacity limits. Is there any plans to enforce anything in terms related to social distancing and mask wearing that the city can do?
Well, with respect to the mask wearing, everybody's supposed to be wearing their mask, okay? And the fine for that is $250 if they, based on the governor's order, you first have to warn people. So it's not just automatic. So under the governor's order, you have to warn them first. And then you can go back, and if they don't adhere to the warning, provide them with a $250 citation or ticket. And so we are doing everything we can in terms of our messaging. We're doing all of that, and you've seen a whole lot of messaging coming from us. The only really tool that we have is the nuclear one. That I have, for example, and that is to put a curfew in at some point in time. So we can do that. But again, it's going to require everyone to do even more. In terms of the occupancy limits, in terms of what restaurants and others can operate, that's the governor's control. That's not my control. Someone sent me an email and said, Mayor, just shut down the city. Well, number one, I don't have the authority to do that. The governor, that's the governor's ability to do. I mean, that's his. He has assumed all of that power. I'm not interested in shutting down the city. I just want us to be in a better position to manage the virus. And if that means dialing some things back, that would be less intrusive than just trying to shut everything down. So I don't think we need to do that. But we have limited tools locally to work with. And that's why we are having these press conferences on a regular basis to constantly try to educate people. The other thing, and I go back to a question that Myra just said, yes, we can be doing everything that we can within the city of Houston, but if the surrounding communities are just operating quite openly and people are traveling from Montgomery County to the city of Houston and back and forth, then that's going to impact our numbers.
Any chance we can get the message for the businesses? Earlier you spoke in Spanish from either Chief Peña or Acevedo.
Okay, I was going to do it, but she specifically.
Thank you.
Yes, if you leave out something.
Okay, thank you, Mayor. So, en español, el mensaje para los negocios que estamos poniendo hoy es que tienen que limitar el número de personas en sus negocios, en los restaurantes, a 75% del cupo. Pero más importante que nada es mantener una distancia física de sus las personas que están frecuentan estos negocios. La razón por qué son 75% es para que haya oportunidad de tener las distancias físicas dentro de esos negocios para prevenir la infección del coronavirus. Y eso es lo que queremos decir a los negocios, es que nos ayuden a mantener esas distancias físicas dentro de sus negocios para poder crear un ambiente seguro para los clientes y para los trabajadores de estos negocios.
J'ai la question, Dr. Pierce. I have a question for you, Dr. Pierce. There is the issue of the vaccine, and I think the population needs to be very aware. We talk about the vaccine. The vaccines have already been approved for emergency use in England. Mm-hmm. These vaccines are produced in Belgium. They are being moved by planes around the world. Why is America delaying the approval? Do we want to see what happens to those who are affected in England and other places, the health workers, those in the nursing home, so that we take advantage of that? Or what is delaying the approval here? Why is England already vaccinating and America is sitting back?
So that would be a question for the folks in England, really, as to why they've approved. We are not changing, we in the United States, as far as I know, and I'm not on those committees, but the Advisory Committee on Immune Practices, ACIP of the CDC, is the normal committee that would meet and review the data. They will meet on December 10th, as they were scheduled long ago, to discuss this data. They will make a recommendation to the FDA, who will go forward. So what's happening here in the United States is following the pre-planned path to get vaccine approval. What's happening in other countries, as far as I can tell, is irrelevant. So, no, I don't think that anyone here in the United States is waiting to see what happens in the UK. Besides, we're moving pretty quickly, so it's only going to be a couple of weeks difference. So, so the United States is moving forward at the pace that they're executing the plan that was put in place, irrespective of what's happening in the UK.
Okay. I think that should do it. I will say to you that, there are added benefits to wearing these masks. There are added benefits in addition to protecting yourself and protecting others. But, two other benefits. Number one, some people have told me that I look better with the mask on. So I think that's pretty, that's pretty good, So, I've gotten text that, Mayor, you look better, so thank you. And the second one, if you're at an event and you're asked to sing, and if you don't know the words, nobody knows that you don't know the words. You just kind of mouth along, So there are added benefits from wearing these masks. Get you one that matches your outfit. What color is this? That's right. This is black. It goes with my accessories. So and feel free to send them in. If you think you got a very different sort of mask, send it in, and we'll talk about it. Okay? So we'll have a contest. But by all means, put your mask on. Thank you all so very much. We'll pick it up again on another day. Thank you.